Good morning. We are going to discuss about wedges used in dentistry. Unfortunately, many dentists and dental students see the insertion of wedge or gingival wedge as a gesture rather than an important segment of the matrix that is built to contain the amalgam. Arbitrarily stuck between the band and the adjoining tooth, it often does more harm than good. The following rules must prevail when using them. Not all cavities need to be wedges. Usually, you place wedges if there is a gap between the gingival seat and the matrix band. Or to retain the or fix the matrix, you can use wedges. Wedges must not restrict the band from bulging outward to develop a good contact point. Gingival margins that terminate above the gingival crest may be routinely braced with any wedge that fits the space and prop the band against the tooth. Wedges should usually be inserted from facially or lingually, depends upon the largest embryo. Wedges must be fitted and customized. Functions of wedges. They are cross adaptation of matrix band to the tooth, gingival to the uh, gingival margin of preparation. Protect the interdental fold by preventing restoration impingement. Define the gingival facial lingual extension of the contact area. Create some separation to compensate for the thickness of matrix band. Establish a traumatic retraction of the rubber dam and the gingiva, thereby producing a temporary hemostasis and minimizing moisture by adaptation. Assure immobilization of matrix band during restoration placement. Classification of wedges based on the shape, anatomic wedges for deeply extended gingival margin because its greatest cross-sectional area is at its base. Non-anatomic preferred with conservative proximal boxes because its wedge action is more crucial near the gingival margin. Based on the material used, wooden wedges, they are easily cut and trimmed and they absorb water intraorally. This causes them to swell improve their intact or interproximal retention. Example, rainbow wedges. Resin wedges, they can be plastically molded and bent to correspond with the configuration of the interdental cone. Example, Fintrec transparent wedges based on the manufacturing, custom made and preformed, based on the consistency, hard, rigid, or soft and compressible. Round toothpick versus triangular, that means anatomic wedges. A triangular wedge will not firmly support the matrix band against the gingival margin in conservative class 2 preparation. You can see the arrow mark. The round toothpick wedge is preferred because its wedging action is near the gingival margin. With the gingival margin, the round toothpick wedge will crimp the matrix band contour if its diameter is above the gingival margin. The triangular wedge is preferred with this preparation because its greatest width is at its base. Modified triangular or anatomic wedge. Depending on the proximal convexity, triangular wedges may distort matrix contour. A sharp blade instrument may be used to modify the triangular steepness of the wedge. Modified and unmodified wedges compared. Properly modified triangular wedge prevent distortion of matrix contour. You can see different types of wedges used in dentistry. Procedure. Break of approximately halving, that means 1.2 centimeter of the round toothpick. Grasp the broken end of the wedge with number 110 plier. Insert the pointed tip from the lingual or facial embrasure, which is larger, slightly gingival to the gingival margin. Bend the Band tightly against the tooth and margin. If necessary, the gingival aspect of the wedge may be slightly wetted with lubricant to facilitate its placement. If the wedge is placed crucial to the gingival margin, the band will be pressed into the preparation, creating an abnormal concavity in the proximal surface of the restoration. The wedge should not be so far apical to the gingival margin that the band will not be held tightly against the gingival margin. This improper wedge placement will result in gingival excess or overhanging margin of restoration. Supporting matrix with the blade Hollenbeck carver during wedge insertion. You can see custom-made tongue blade wedge may be used when excessive space exists between adjacent tooths. Type of wedging. One is piggyback wedging. When wedge is significantly apical to the gingival margin, a second wedge, usually smaller in piggyback on the first one. Indication when proximal box is shallow gingivally or interproximal tissue level has recede or both. Double wedging refers to inserting two wedges, one from the lingual and the second from the facial embrasure. The two wedges help to ensure that the gingival corner of the wide proximal box can be properly condensed as well as to minimize the gingival excess. Indication, facial wide proximal boxes to provide maximum closure of band along with gingival margin. Wet wedging, when concavity is present on both proximal surface gingivally of the condyle and extending as a rooting onto the root, that mesial aspect of maxillary first premolar. Here the second wedge is inserted from lingual embrasure between the first wedge and the band. The remaining portion we will discuss in next class.